So the question is, should you use ice or heat on an injury? I get this question asked all the time. And the fact is that the traditional thing of putting ice on an injury or a sprained ankle really doesn't hold true anymore. In fact, most of the time, we don't even ice injuries. And the reason is really simple, actually. The damaged tissues need a blood supply to help facilitate the healing process. Actually, part of the healing process is the inflammatory response. So you actually need inflammation to help facilitate and kickstart the healing process. And so when you have an injury, if you put ice on that injury, you're actually restricting blood flow, and at the same time, you're limiting the ability of the body to start that healing process. So I always recommend to my patients, if they have some sort of injury or some chronic pain or whatnot, to refrain from using ice, because we actually want blood flow to flow through into those tissues to help facilitate that healing. And then invariably the question always comes up, and you're probably thinking the same thing, is, well, what about the swelling? Well, the fact is that the swelling of damaged tissues, if you have a sprained ankle, that swelling is not going to be eliminated by putting ice on it. In fact, the swelling is mediated through and controlled by the lymphatic system, and the lymphatic system is controlled by muscle contractions of those tissues and of those vessels. So the recommendation is refrain from ice, use some moderate movement and muscle contraction within a pain tolerance, and if you employ this, you're going to have a much better quality ability to heal from those damaged tissues and recover fully.